Hello dear students, welcome back to my YouTube channel Physiology Learning. Today we are going to continue our ECG series. In the previous video we saw about the history of ECG and Einthoven's role in inventing the ECG and various other scientists. In today's video what we are going to do is we are going to see about the electrodes and leads of the ECG. So what are electrodes, leads and everything, and how many different types of leads we place it to record an ECG. So we are going to go and understand these concepts today. So coming to the terms. So what is an electrode? So first we should understand what is the difference between an electrode and a lead. Electrodes, these are conductive pads. For example, whichever element you are placing on the surface of the person to record the electrical activity of the heart, that is called as an electrode. And if you are measuring the potential difference or measuring or recording or taking up the voltage from that electrode, then they will form the lead. So by definition, the conductive pads that are attached to the skin to record the electrical activities. So they are going to pick up the electrical currents and record it. Whereas leads are the measurements we get from the different electrodes. Suppose, for example, if you have attached two electrodes on the surface of right and left arm, when you are measuring the potential difference across them, then we get the lead. So electrodes are just attachments. Whenever you're measuring the difference between the electrical potential, it is called as lead. Then we have to understand what is the concept of bipolar lead and unipolar lead. So bipolar leads, they record the potential difference between electrodes, between two electrodes especially. Whereas in unipolar lead, what they are going to do is, ideally this is not a just one single electrode placed and it is recording it. Here also there will be involvement of multiple electrodes, but what happens here is there will be one exploring electrode. So there will be one exploring electrode and the recording will be going on, and the other electrode will be connected to a high resistance voltmeters. So if it is showing high resistance like 5000 ohm, then what is going to happen? Whenever we are measuring the potential difference between these 2 points like A and B, we are not going to get any recording from B since it is connected to a high resistance voltmeter. That is why these leads are called as unipolar leads, because the recording that we are obtaining is coming from one area. That is why it is called unipolar lead. But ultimately this also will have another electrode which is attached to a high resistance area. So that is the unipolar leads. Bipolar means there is no high resistance, two electrodes are there and their voltage difference. Unipolar means one exploring electrode, another one is called as the indifferent electrode. So whichever we are attaching here to record it, that is called as exploring electrode. And later on we will see that this bipolar leads, the limb leads are called as bipolar leads. And whereas the chest leads, which is we are going to attach this on the chest, that is the chest leads, and the other group of leads which is called as augmented leads. Augmented leads, they are called as unipolar leads. So now coming to the ECG leads. Now we have understood electrodes. So whatever from now on we are going to talk, that is about the leads, because all our recordings are done by the measurement between electrodes, that is the leads. So total number of leads in a standard ECG. So whenever you are going to a setup and we are going to take an ECG lead, the total number of leads, we are going to get the output as 12 leads. So this is called as standard ECG leads. Standard ECG leads. So this 12 leads are generally used, and some other leads are used on special occasions, but generally these 12 leads are used. Then what are these 12 leads is, here we have limb leads which are exclusively identified by the Einthoven, that is around 3 limb leads. And we have the chest leads which is identified by Wilson. Here we have 6 chest leads. And we have the augmented leads identified by Goldberger, that is around 3. So total we have 12 leads. So you can ask me a question. We are just recording the electrical activity of one heart, but why are we having so many leads? To answer this simple question, what is the purpose of this many leads? So if you think so, it is very logical. Suppose it is just like viewing an object in multiple different angles. so that whatever abnormalities are there which is not captured by one camera, it will be captured by the other camera. For example, you have an apple and it has a rotten surface on its left side, and you are viewing the apple from the right side. So will you be observing this? The answer is no. Another simple funny example is somebody is taking a class for you and he is sitting and taking it in a YouTube lecture like me. You will not be able to guess whether I am wearing pants or a shorts. Why? Because there is no camera which is placed to catch the inferior surface of the person. Suppose if I have multiple cameras and show different angles of it, you will be able to observe what are the different objects and other elements present in other angles also. So to capture various different angles, we need to have multiple leads. So the same heart's activity, we are trying to capture it with various different cameras at a different angle to understand and observe the various different changes occurring in various different walls of the heart. So that is why we need multiple leads. So we will go one by one now. So first, coming to the limb leads. Limb leads, as the name suggests, we are going to attach them on the limbs of the person. So preferably we will be attaching them in three places. One is the right arm, another one is the left arm, and another one is the left leg. So we are going to attach between the right arm, and left leg. Why are we doing like this is, we Einthoven try to triangulate the heart and try to take the electrical activity of the heart in this three direction. Of course, this was not self-sufficient. That's why later on other scientists introduced various other leads. But for Einthoven, he wanted to construct a triangle at the heart and try to picture it in multiple different angles. So this triangle, which was also called as Einthoven triangle. And he was the one who gave the concept about the three limb leads. So these are the three attachments we are going to do: the right arm, and left leg. If you are going to a standard ECG setup and recording and placing the leads or the electrodes, what you will observe is these are standardized, and whichever is attached to the right arm, they are generally red in color. You can easily remember R for R. Why it is important is, if the leads are interchanged, then the person might be normal, but there will be an abnormality in the ECG just by changing the leads. We will try to understand those concepts also in the coming videos. Then we have the left arm, then we have the left leg. Leg is towards the ground, so you remember it is towards ground. So the color of the electrode which we are going to attach here is green. So you can remember it like towards the ground, green, G for G. And the other one is yellow in color, which goes to the left arm. And we will be attaching one more electrode which is not going to record anything. It is just going to do the grounding of the person. So only one leg is left. So there in the right leg, what we can put is, we can put an electrode which will act like a grounding agent. So it helps to avoid any kind of electrical activity which is recorded that is affected by other interferences. That is, when the person is getting some kind of electrical mismatch circuit and some abnormal electric shock he is getting from the instrument, what will happen? This will be grounded easily. So this grounding electrode, like we see it in our day-to-day household circuits also, it is generally black in color. So these are the standard colors, but still it is your job to check it once before putting it on the subject, because very rarely it changes, but most of the times red for right arm, yellow for left arm, and green for the left leg. And now, because based on this triangle, he constructed the electrodes. So whatever lead he was attaching between right arm and the left arm, he labeled it as lead 1. So he gave the name as lead 1. And between the right arm and the left leg, it was lead 2. And between the left arm and the left leg, it is the lead 3. Then Einthoven wanted to do the recording. He wanted to observe most of the waves as positive. So now he designed these limb leads in such a way that the most of the recordings, the QRS complex gives a positive deflection. The R wave comes as positive. So what did he do is, the SA node is firing and it is generating the impulse and traveling towards this direction. Obviously, it will give it to the AV node and the AV node will conduct it further, but it is in this direction as you can see from the diagram. So what did he do is, he constructed the electrodes positive and negative terminals in such a way that most of the waves which are recorded, especially the R wave, comes out positive. So what did he do? So it is in this direction, the positive depolarization is happening in this direction. Whenever it is moving towards a positive electrode, the deflection is going to be positive. Whenever the positive ions move towards a positive electrode, the deflection is going to be positive. Don't worry, I will tell this concept later on when the waves are generated also. But for now, just remember, positive waves moving towards a positive electrode is going to give positive. So he devised the left leg electrode always positive. Why? Because the waves are going like this, so he kept the left leg always positive. And which lead is looking away from the heart? The lead that is in the right arm, it is in this direction, it is looking it away from the heart. So the right arm's lead, he always gave it negative. And the left arm's lead is going to change because these two are determined. So the left arm is going to change according to the situation. In the right arm, the negative is taken by the lead one, the negative is taken by the right arm. So the left arm will be positive. In the lead 3, the left leg is already positive. There, the left arm's electrode will be negative. So if you wish to write it down here, so in the lead 1, what did we do? Right arm we gave negative, left arm we gave positive terminal. So because we have to construct one positive and one negative. This is for the lead 1. And in the lead 2, the right arm is again negative, the left leg is positive. In case of lead 3, the left arm is going to be negative and the left leg is going to be positive again. As you can observe from here, the left leg is always positive and the right arm is always negative because the left leg is in the direction of the heart or the positive waves which is in the direction, and the right arm is away from it, so those are predetermined. But in an examiner ask it, you can just simply think about it and give your answer. So, but the concept behind that is this one. Next thing is, there is something called as Einthoven's law. What is this Einthoven's law is? Since it is an equilateral triangle, according to this triangle, the lead 2, which is in the direction of the heart, is equal to lead 1 plus lead 3. Because the lead 2 is in the direction of the heart, the summation of the other two lead will give lead 2. So this law is also identified by Einthoven and it is called as Einthoven law. So the triangle is also Einthoven's triangle and the law is also Einthoven's law. That's why Einthoven has worked a lot on the limb leads and made all these observations. Now coming to the next group of leads, as you can see, this is the diagrammatic representation of the limb lead. One lead is placed right arm, the left arm and the left leg. Here they have not shown the grounding. Grounding will go to the right leg. So that is the same thing whichever I have explained it above. You can go back and check this diagram. The positivity and negativity, it will be perfectly correct. Otherwise, sometimes you can place the lead on the surface of the chest also, like this. So ultimately, whether you place it on the surface or in the periphery, in the limbs or on the surface, our ultimate aim is to construct a triangle around the heart so that the waves are captured in the different cameras or the different leads. Next, we can move on to the augmented lead. For the augmented leads, we are not going to put in any separate electrodes. Please remember, there are around 12 leads, but number of electrodes that we are going to put is 9. I will tell you how. For the limb leads, 3 limb leads we are going to put in 3 areas, and 6 chest leads we are going to put, so that comes around 9. Plus 1 is for grounding. If you consider that also, there will be 10 electrodes which are hanging in the wire, whichever setup you are getting. Here we have just 9 electrodes, but we are able to take a 12 leads. How is it possible? The limb leads are already attached. This augmented leads will take the recording from this specific areas by connecting the other two to a high resistance ohms. So it is going to pick the recording just from this place. So the lead is already there. The machine is going to calculate it and then do the adjustments for it. So whatever potential we are observing in these leads which are already attached in the limb leads, they will give the augmented leads value also. That is internally done by the machine by connecting the other two leads to a high resistance ohm whenever they are forming a triangle. And from the term augmentation, English itself, it means that enhancement. So what does this augmented leads do is, whatever potential it is getting in this particular lead, it is going to enhance. So one is already in the right arm, that is AVR, one is in the left arm, that is the AVL, and another one is in the foot, AVF. So this is also going to take the recording from the same limb leads which are attached. And how much augmentation it is going to give? It is going to give augment 50%. For example, if the voltage that is generated is 2 millivolt at an area, the augmented lead will give 50% excess, that is 2 millivolt plus 1 millivolt. 50% of 2 is 1, so that will be 3 millivolt. Why do we need to augment it? Because the scientist Goldberger felt that by augmenting the stimulus, it is easier to read. So all the dimensions of the wave is going to be same. All the parameters is going to be just expanded and zoomed in and augmented 50%. For example, if a wave is observed very small, the same dimensions, like the same right side is going to be increased to the same level and left is also increased to the same level. There will be a 50% augmentation by this specific electrode. He wanted to better observe the wave, so 50% augmentation was done. So this is all about the augmented lead. Now we will be coming to the chest leads. And chest leads, already I have mentioned that there are 6 chest leads starting from V1 to V6. V1, V2, V3, V4, V5, V6. And you have to know the exact location of these leads, but because sometimes if the technician or anybody places the leads improperly, then also there will be some mismatched readings, you will get it. So coming to the chest leads, the placement is again important. V1, it is placed in the 4th intercostal space on right side. V2, it is also placed on the 4th intercostal space on left side of the sternum. So left side. Then V3 does not have any specific space. V4, V5, V6. All this V4, V5, V6, all of them, their space is common. They are going to be placed in the 5th intercostal space. Among that, V1 is going to be in the mid-clavicular line. Then V2, V5 is going to be placed in the anterior axillary line. These are anatomical landmarks, anterior axillary line. And V6 is going to be placed in the mid axillary line. So all of them will go to the same intercostal space, V4, V5, V6. All of them in the 5th intercostal space. One will be in the mid clavicular line, one in the anterior axillary line, one in the mid axillary line. And V3 will be in between V2 and V4. Once you have placed V2 and V4, you can place them in between, V3 in between them. So these are the lead placements, and again these are the unipolar leads. So what we are going to do? We are going to construct one lead, that is the exploring electrode, and whichever is placed, and the other ones which are already attached to the limb, they will construct like an indifferent electrode which are coming through a high resistance voltmeter. That is high resistance, they have to pass through it, so no recording will be done. So one will be our exploring electrode, which is going to explore the values, exploring electrode. Because we cannot take the recording potential difference by comparing by not having another electrode. That's why this setup is made in such a way that the exploring electrode will explore it, the other will be attached just for the giving it as a reference. The other will be attached acting as a zero potential, we can say. So these are the exploring electrodes. So generally whenever you are recording any ECG, these are the 12 leads that will be recorded. So first we have the 3 limb leads, 3 augmented leads. Both are recorded from the attachments of limb leads, and 6 chest leads. I told you the location where we have to place it in. Then what we are trying to do is, now we are trying to take the photograph of the heart in multiple different angles. That's what I have already told you. In the frontal plane, like the superior and inferior side, we are having the limb leads plus augmented leads. So in the limb leads, lead 1 positivity was on the left arm and negativity is on the right side. So that's why negativity they have dashed, given in dashed lines. Then lead 2, it is going from the right arm to the left leg, and left leg was positive, the other side was negative. And lead 3, it is going from the left arm to the left leg. The left arm is negative, the other one is positive. In a similar way, AVR's positive is going to be here. So AVR we have attached here, so its positive is here, the other end will be negative. And AVL's positive will be here, whichever we have attached on the left side. Then AVF positive will be here. The other dashed side is the other dashed ones are the negative side. Then to check it in the horizontal plane, we have the chest lead. So horizontal means antero-posterior. So these cameras are going to take the picture antero-posteriorly. So antero-posteriorly from V1 to V6. This will help us to identify when we are studying a myocardial infarction. Just by looking at the ECG, we can understand whether the inferior wall of the heart is affected, or the lateral wall is affected, or the anterior wall is affected. All these things can be easily identified with just the help of the ECG. We are not going to do any intervention to the patient, but just by placing these leads, you can identify what has happened inside the heart. So that's the beauty about ECG. These are the classical 12 leads, and there are some other leads which are used in special occasions. For example, as you can see here, V7, V8 and V9. Till V6 we have already done. V7, it is also in the 5th intercostal space in posterior axillary line. We have came till mid-axillary line, it will be the posterior axillary line. Why do we need to place this posterior lead? Because the logic is pretty simple. If somebody is having a posterior wall MI, then none of the front cameras will catch it. So we wanted to have some leads in when we are suspecting a posterior wall MI. But routinely this is not done. Routinely the standard 12 leads are done. These are special leads. Then we have the V8 at the tip of the scapula, and the paravertebral area we have the V9. So these are the posterior leads, V7, V8, V9. Posterior leads can be V7, V8 and V9. Then we have right-sided 12-lead ECG placement. If somebody is having a dextrocardiac and their heart is on the right side, so all the chest lead setups, you have to place it completely on this side. Then the name given is V1R, V2R. Why? Because we are placing it on the right side. So V3R, V4R, V5R, V6R. Sometimes there is a special lead placement which is done wherein you will place all the leads in a regular place except this V4R. We will place this V4 on the right side. Identify and tell me the condition. You can comment in the comment box and give me the answer. What is the reason sometimes we have to place this V4R alone on the right side? What it helps us to detect, and which kind of maybe myocardial infarction it is used, why it is placed on the right side. So this is all about various leads and electrodes of the ECG. If you have any further doubts, kindly drop it in the comment section. You can drop it in the comment section why this V4R is placed. So thank you for watching the video. We'll see you in the next video. Thank you so much.